Hi, Jeja. Thank you for agreeing to let us interview you today.
Hi, thanks. Hi, everybody. I'm Jida Syeda. Nice to meet y'all. Um,
All right. So we're gonna ask you a few questions today. Um, our first question is, what is your professional title?
I am a emergency medicine doctor.
Okay. And what are your main responsibilities?
Um, it's whatever walks through my ER, I have to see. There's a rule called EMTALA, which basically requires you to see every patient that walks through the ER door that wants to be seen. Obviously, some people leave and they don't like the waiting times or whatever. They don't like me, and then they leave, and that's okay. But if they come in and they're seeking help, I have to see them if they actually come to me.
Okay. So what is a typical day like in the ER?
It typical days can really vary because one day you'll have the ER is completely full, everything is overflowing, and then there are some days where people don't come, you know. Um, so a typical day for me is basically I go to work and I um basically see what we have and then just knock out one by one, I guess. Um, Most of the days I see about two people an hour. Um, and so my shifts are either 8 hours or 12 hours. And most ER shifts are like that. They don't go past 12 hours per shift. So it's either 8, 9, 10. I've never heard of 11, but maybe there's somewhere there's 11, 11, and 12.
Okay. Do you typically work with the same people?
No, I do shift work. So all ER doctors do shift work. And so, they change. So I work in what we call a single um doctor ER. So I'm the only doctor when I'm in the emergency room, but I also work with a nurse practitioners and physician assistants. So during the daytime, when our volume is typically higher, we get two people that we work with. Either it's a nurse practitioner or a physician assistant, but two of them come in during the day and help see patients as well. Um, and basically, your job is to supervise them, and they also do shift work, so it changes who comes what day. And then you also have your nursing staff, which they also do shift work, so it changes from day to day.
All right. Thank you. Does someone want to take over for the part two questions?
I can go. Did you always want to be an ER doctor, or did you change paths at all while in school?
Yeah, so I mean, I always wanted to be a doctor. I think my biggest interest was I wanted to do more global medicine where I get to travel and help people that really need help. And when I first went into medical school, I did what maybe like 80, 90% of the girls do whenever they go. They're like, oh, I want to be a pediatrician. And anyways, I did my pediatrics rotation and I realized just a lot of, oh, it's my 2-year-old visit. Here's your shots, here's your development. And it wasn't really that exciting for me. And so when I did my emergency room rotation, it was just an eye opener and I loved it. I loved I think when you're a medical student, they try to show you all the exciting things and, the typical things. And it was just really eye-opening. And I didn't realize how much, I would like it, because you don't really get to hear too much about an ER doctor. You hear a lot about doctors that you see. But, if you've not been to the ER, you just don't have that experience. But when you do the rotation, it was really exciting for me. So that's why I chose it.
What was your major in undergrad?
I did biomedical engineering. And no, you don't need to do that to go to med school.
Is there anything you wish you had known before starting this job?
Yeah, I think before going to med school in general, I didn't realize how demanding it would be. My job as an ER physician is not that bad as attending because I finished my residency, but it becomes your life, you know. I was married through med school, and then I also have I had a child in med school as well. And you really don't have too much family time. And I didn't realize that when I got into it, I didn't realize how bad it will be. And so, from a family perspective, it really does affect your life. And, I just never thought of that.
Thank you. Does someone else want to take the next few questions?
I can do those.
Okay.
Did you feel prepared after graduating?
Graduating just like from medical school or residency.
Let's go with medical school.
Okay. So medical school, you learn a lot of things that aren't necessarily very practical. And so, I would say that first month of residency is just plain terrifying because you're like, I don't really know anything and I'm making decisions that affect people, you know. I don't know if you can say that you're 100% ready whenever you finish med school just because you don't have that practical experience. And I think all my colleagues felt the same way. That first month of adjusting is rough. And then after finishing residency, same thing, you realize you're alone and you're the only person who sees this person, and it's a big responsibility. And I think it after maybe 6 months of after residency working, did I feel like, oh yeah, I can do this.
What are your next steps in your career?
Sometimes people choose to do fellowships in emergency medicine, which lets you basically specialize in something specific, like um, you want to maybe do a fellowship in learning how to do ultrasounds. It's I think a 2-year fellowship, and you just do ultrasounds throughout the ER and basically become good at doing emergency ultrasounds. Some people do EMS. So when you do EMS fellowship, it means that you get to basically become like a director of emergency medical services. So you handle like the ambulance workers, their protocols, their how should they, if they run into chest pain, what should the steps be that they take? So you get to be in charge of that. You get to work on kind of their logistics, like, you know, who should be available at what time, how many do you need, those kinds of things. You can choose to do a global fellowship, which is something that I'm actually interested in doing, which is basically you learn how to basically treat communities around the world that need help. You can do disaster medicine, which is a fellowship for the ER doctors, which basically if there's a natural disaster or some kind of disaster, you go on site at that time immediately, and you help, do whatever, like, everybody who's hurt, everybody who's sick, you just see them. And those people, like, I mean, that's interesting for me, but those people sometimes stay up 24 to 48 hours seeing people just because there's so many people to be seen and they just don't have the resources or ability to manage that. So there's definitely a lot of fellowships. And I think one of them kind of fit what I want to do. Do I have to do it to do that job? Probably not. There's a lot of things that you can do to sign up and travel to a site to help out. I was actually recently looking at a job in Uganda that you can volunteer for, and you go over there and you teach. You get to teach and see people that need access to medicine, and you teach a non-doctor provider to provide basic needs, or to areas where you just don't have access to doctors. And so it's interesting. And the next steps for me would be to consider more of a global medicine picture.
Okay. How relevant to your work is your undergraduate degree?
And my undergrad degree is not relevant at all to what I do now. Like 0%.
All right. Does anyone want to take part 4?
I can go ahead and take over. Okay, so over this past year, obviously COVID has been a really big part of everybody's lives. So has that impacted your job in any way? And has it made it more stressful? And how would you say you've dealt with it?
Yeah. So initially when COVID happened, we didn't have many resources, and that was throughout, the world. So there was a shortage of supplies of masks, gowns, gloves. And at that time, it was stressful because we didn't know what we were working with. We didn't know what, you know, we were, for instance, reusing masks. And, we would use like one mask essentially for a week because we just didn't have enough masks to get us through anything. And just so you understand, these masks are supposed to be a one-time, one patient use mask because one, you don't want to recontaminate yourself or another patient by wearing the same mask. But since we didn't have anything, we just had to go with it. It wasn't much to do about that. And so it was stressful because you had to come home to your families, and, you know, um, how do you not spread it? So initially I had made a what I call a decon shower in my backyard. So the plan was I go into this makeshift shower with my hose, and I just wash myself down, and then I run inside the house and maybe take another shower or something. And that became not very feasible just because that was such cold water. Like I did it twice and I was like, I can't do this anymore. So then the goal was that I come home, I directly go into the bathroom, I take off, everything from work, I shower, I come out, I put that stuff in the laundry and wash it. And that was good enough for us. I used to wear a mask in the house just in case I caught it. So I didn't spread to my kids or my husband. And then I had a quarantine room where that was the room I stayed in. And that kind of sucked because I was in a room all alone by myself. And I did that for a month before I was like, I can't live by myself in a room. Like, that's just not good for my, mental well-being. And my husband was like, look, this is ridiculous. You haven't fallen sick. And so I got this mask. It's actually an industrial mask. And so it's basically makes me feel and look like Darth Vader. Let me see if I have it over here. Let me show you. Yep. So I got this mask basically off of eBay, and even these were in short supply. And this is used like for, paint projects or, things where there would be heavy dust particulates and stuff, and it's supposed to filter everything out. And it's actually it's called a P100. And so it filters out just about anything to the it's more effective than a N95 because it takes out 100% of particulates. It goes down to certain nanometers. That's more effective than an N95. So once I had this mask, I felt more comfortable that I wasn't bringing anything home. And so I started living a semi-normal life. But yeah, I would change the filters. I would go into my car, take the filters off, put them in a bag, and I would have 4 bags of 4 sets of filters, and I would do 1 bag per shift. And then there was a study done saying that COVID disappeared off of most surfaces by 72 hours. So I would reuse a mask, a filter every 72 hours. And that became my normal for a long time. And now that I'm vaccinated, I have to say that it's much less stressful. And I don't wear that mask anymore. I wear N95s. So now we have a lot of masks available to us. And so I use 1 mask per day, and I feel more confident that I'm not going to spread something.
Right, thank you. And so this next one's going to be kind of a 2-for-1 question. So how would you say you balance your work and social life? And would you have any advice for students when it comes to this?
Yeah, so right now that I'm an attending and I'm done with all my training and everything, my work and social life are great. I work 100 hours a month, so that's about 2 to 3 days a week. And the rest of the time I have off. If I want to go for a run, I can go for a run. If I want to see friends, I can go see friends. If I want to, go out anywhere, I have ability to do that. The only problems become like sometimes you have shifts on like a Friday night or over the weekend, and so most of your friends are free during that time. And so sometimes it like there might be a couple of weeks where you just are, a couple of weeks a month where you're just like, well, I guess I'm not gonna be able to see people. But you have a lot of friends who do similar things, and so it's easy from that perspective, because you can easily make shifts and focus on meeting up with them, by just they have weird schedules, you have weird schedules, and you sometimes it aligns and you get to see them.
All right, thank you. So last part coming up.
Hi, yes, I'm currently taking notes. Would someone like to jump in to do part 5? Sorry, I was taking notes throughout the whole process. But yeah.
I can if you want me to, Angela.
Yes, please, that would be great.
Okay. what would you say is the most rewarding part of being an ER doctor?
So, it doesn't happen all the time, but there's, you know, once a few shifts, maybe once every 5, 6 shifts where you get to save somebody's life. And it's very rewarding because you feel like you actually made a difference. I mean, I don't know if you believe in fate or destiny. Maybe it was meant to be like that, but it just helps you feel good that you feel like you made a difference.
What was your most memorable case and why?
That's a hard question to answer because my mind becomes a like jumble when I try to think about the past because you see so many things. I guess we had a 8-month-old who had a seizure and had multiple seizures actually. And so they came in very sick and, we got an IV, we got all of these things done. We gave them medicines. They went to the ICU and they were completely fine. They came out fine. They have no issues and no brain damage or anything from the seizure. And it just made you feel really good because you save, someone from having, brain damage essentially because they were having so many seizures. And it helps when they're a child because, they have so much potential and it just, yes, that was one of the things that has really stuck with me, that 8-month-old.
Is there anything you wish you could change about your profession?
Yes. Sometimes, it's hard to predict how many people will come to the ER. I wish we had more of a call schedule. So if it got really bad, we can call an extra person in. Yeah, sometimes there's 8, 9 people that show up, every hour. And when it's just you and a one PA or one nurse practitioner or 2 even, it just gets very difficult just to keep up with things because you have to see, a little bit of everything at once. I remember I had a code one time. We were doing CPR and we did CPR for an hour. They were a fairly young person, so we did CPR for an hour and we finally got them back, we had a pulse and everything. And then I go into my next room and it was somebody who has toe pain and he cursed me out. He's like, I've been waiting for 2 hours to be seen. I've been in this room for an hour and you didn't come in. What kind of service am I getting? And, it would have been easier if somebody was able to see that toe pain while I was running the code. Because it sucks. I mean, I get cursed out fairly often, actually. But it sucks even more when, you work so hard doing something and then you come in and immediately get cursed out. But you memorize a line, which is basically you tell them, I'm sorry you're having pain, or I'm sorry you're experiencing this. I got a little preoccupied and I'm sorry about that, but I'm here and I'm 100%, you have my 100% attention and I'm going to try to help you as much as I can. And it's sometimes hard to stomach saying that to somebody who's cursing at you and for their toe pain, but whatever, that's just part of the job.
Thank you. I think that's all the questions we have, unless someone else had anything.
Yeah, if I can jump in, I actually had a quick question. Seeing your journey, it's very inspiring and it's very interesting to see all the work that you do. So one thing that I'm wondering is, like, throughout your whole process from undergrad to going to medical school to where you are right now, what has been your biggest motivation? What has pushed you on those days where you feel like giving up, if you've had any of those days?
Yeah, I think it's just really knowing that, I may one day have an impact on somebody's life, is really what pushed me forward. Is, like, you can provide, like I said, it doesn't happen very often. It doesn't happen as much as you see in some of these TV shows, for sure. But you can make a difference in somebody's life, and that really motivates you to continue. And if you have an experience where that happens, it's encourages you even more to keep doing what you're doing. But we do have a what we call burnout, is basically when you just become so overwhelmed with everything that you just don't find enjoyment in doing your work, and you don't want to do it anymore. There's a lot of burnout sometimes, and not just my field, but in other fields too, where things can be very demanding or challenging. And so we do experience that. And most ER doctors don't necessarily work, into their 60s, 70s, 80s. Most ER doctors are, I think, done by their 50s, just because there is a burnout associated with the job. And then I also wanted to add about social life in medical school and residency. I just didn't have one. You don't have time. You really just don't have time. Once in a while, like, you'll have an event where you get to go out with family, or friends, but it's definitely not very common. And I went to med school is 4 years, and residency can be anywhere from 3 to 7, 8 years. I picked a 3-year residency because I just couldn't see myself doing more than 3 years. But the other 3-year residencies are usually primary care residencies. So, like, family medicine, internal medicine, pediatrics, those tend to be 3-year residencies as well.
I see. That sounds very, it's nice to hear how you were able to deal with this through stress, and keep yourself motivated. It's very nice to hear. And on top of that, would you say, like, going into medical school, for students who feel unmotivated or feel who are incapable of reaching medical school, or having the ability to even pursue higher education above getting your undergrad, what advice would you give?
Let's just say, if you already don't feel like going to med school, don't go to med school. It was not that it was challenging from a content perspective. It just required so much of your time, and you do tend to build kind of resentment, especially if this is not something you wanted to do, or you're only doing it because of some reason, like family, or you're not really doing it for yourself, or you don't find enjoyment in itself. It's just not worth it, because it does take up a lot of your time. It is very demanding and challenging, and it's just not worth it if you get into it for any reason except this is something you want to do.
Interesting. Those are all the questions that I have. I don't know if anyone wants to jump in.
I think I'm good. Again, thank you so much for agreeing to do this. You obviously have a very busy schedule, as we just learned.
I actually don't. I actually don't. I work 2 shifts over the weekend, and I worked overnight, so I slept most of today. I'm free until, I think I don't work again till Thursday. So yeah, that's not a problem.
Okay, thank you so much, Jija.